I think the conservative management that we currently teach people suffering with obesity is too outdated. Now, there has been some promising advancement in terms of pharmaceutical and surgical treatment for people suffering with obesity. However, little has changed in terms of conservative management. We essentially tell people that it is 80% dietary changes that they need to make and 20% exercise, or somewhere along these numbers. And that is not bad advice. However, it is missing a key element, an element that limits how effective and how sustainable the aforementioned advice really is. So let's take a deeper dive into this.
You see, at its core, obesity is a behavioral issue. Although it sounds obvious, yet we seem to collectively ignore this reality, despite many people battling with obesity telling us this very fact. So, obesity starts with behaviors and maladaptive skills that lead to overeating, becoming overweight, and eventually obese. This in turn sets us up for a slew of complications, including chronic inflammation, insulin resistance, occupational dysfunction, meaning it affects us at work in terms of mobility issues and other issues, recreational dysfunction, meaning it gets in the way of our ability to have fun, depression, anxiety, sexual dysfunction, social discrimination, social isolation in some cases, chronic pain, and overall lower quality of life. And once these go on for long enough, eventually they start to lead to more serious changes that set us up for a variety of problems. Things like diabetes, various abnormalities of our endocrine system, meaning that various hormones get out of balance. Hyperlipidemia as well, which means high blood levels of cholesterol and fat. Hypertension, which means high blood pressure. Various cardiovascular diseases, including heart attacks and vascular disease of the abdomen and of the limbs. Also, non-alcoholic fatty liver disease, which is fatty liver, and non-alcoholic steatohepatitis, which is inflammation of the liver due to excess fat. It could also lead to respiratory problems such as obstructive sleep apnea, which is essentially choking during sleep due to collapsed airways due to the weight over them, and obesity hypoventilation syndrome as well. It could lead to joint problems, including premature joint failure, kidney disease, stroke, and 11 types of cancer that we know of so far that are more common in obese individuals. The thing is, all of these feed into each other. The sicker we get, the more depressed we get, the more occupational, functional, and recreational dysfunction we get, which in turn amplifies our maladaptive coping skills that led to the weight problem in the first place, which in turn worsens our insulin resistance, high cholesterol, fatty liver, and all the other disease. It's a vicious cycle that feeds and grows the longer it goes. And it all starts here. It all starts with a harmless cookie that we have one day at work to soothe ourselves because we had a negative comment, which is completely okay as long as we realize that we need more effective ways to deal with our emotions and we don't rely solely on this blissful marvel of chemistry and marketing. As long as these foods don't become our main way of managing our emotions to the point that food becomes an emotional crutch, which eventually sends us into a dysfunctional relationship with food, where we don't really enjoy our food because it's attached to too many negative emotions. All while not really dealing with our negative emotions in a healthy and constructive way. And now that I brought this to your attention, it becomes clearer what we need to do about it. So the root causes of obesity are behavioral issues, including poor emotional management, poor coping skills, maladaptive stress management skills, self-judgment, shame, dysfunctional guilt, misinterpreting emotions as hunger, eventually feeding into overeating, binge eating, food and eating addiction, with subsequent withdrawal states, which subsequently leads to suppression of our dopaminergic reward system and its important functions of pleasure, motivation, and anticipatory behavior. Yes, our eating behavior can suppress our motivation and pleasure in other aspects of our life, including work, family, hobbies, dreams, aspirations, and other things. Now imagine telling someone who is going through this to go on a diet and start exercising, which is a great idea and concept, but they'll have to wait for the time when things get more stable in their life without much stress, or maybe a later time when they are a bit more motivated. And when the time comes and they decide to make their health a priority, they follow this perfectly structured nutrition and exercise program and they lose weight for a couple of months, and then life happens, which it inevitably will, and their focus shifts to something else other than their perfectly constructed program. All these background behavioral maladaptive coping skills start to resurface again, and they regain the weight. This story happens way too often. We expect people already stressed and demotivated to follow a strict nutritional and exercise program that requires a lot of motivation to embark on, which by itself adds further to their stress levels. Add to that the sea of information and misinformation that is unregulated and largely beneficial to the industry, and it starts to make sense why people are struggling. Don't get me wrong, I am all for nutritional and exercise programs that are built based on evidence. In fact, they do help with mental health to some extent as well, as many research papers have shown. But it is by no means enough by itself. I think the best weight management system is one that takes care of the root causes as well, in addition to the actual weight problem in terms of nutrition and exercise. You see, a well-structured nutritional and exercise program will target the overweight and the obesity issues, which will eventually improve our insulin resistance, diabetes, hypertension, etc., etc. It will also unintentionally improve the status of our dopaminergic system in terms of improved motivation, reward, and pleasure. Exercise even helps with stress management. However, it does nothing to emotional management, self-judgment, dysfunctional guilt, or dealing with cravings in a healthy way that doesn't rely on depleting your willpower. And to make matters more complicated, all these mental health factors feed into each other as well as feeding into the secondary outcomes that we talked about earlier, which in turn can put strain on our mental health as well. Now, we usually don't have all of these factors, and there are other factors as well that have not been captured by this diagram. However, there are usually a few clear culprits that mess things up for us. I find it really helps to zoom out and look at the problem of obesity in a broader view. Make sure that the plan actually makes sense in the long term. The reality is that all these here, the root causes, are fairly simple to target. And please note that I'm using the word simple, and simple doesn't necessarily mean easy. Nevertheless, the tools to navigate ourselves out of this are fairly simple to learn and apply once we understand them. Now, the reality is that we are all affected differently by these factors, so a one-size-fits-all solution is not going to work. In a perfect world, each of us will have a psychotherapist, nutritionist, and a physiotherapist, in addition to a primary care physician, who will refer you to the relevant specialties according to what complications we have. Even then, however, all these services cannot be with you 24 hours a day, and the cost will likely be prohibitive for many. The reason I am saying you need them 24 hours is because observing your emotional habits and how it affects your eating behavior is a 24-hour-a-day endeavor. Intervening with mental health tools during specific times, such as cravings and keeping track of your progress, is also 24 hours a day endeavor, as is taking note of the ebb and flow of your emotional states and mental state throughout the day. I think a more realistic solution is education. Good educational programs that are evidence based and translate all these complex findings into language that the average person can understand and adapt. In addition to expert advice as well from professionals in various fields where we don't have enough research, which I have to say is a huge problem in obesity and mental health. I will soon make a video to help you understand what evidence based actually means and what its power is and what limitations it inherently has. For now, let's go into more details about what other sources of education we have at our disposal in addition to evidence-based education and advice from professionals. And I think another strong source is learning about relevant fields that are not directly related to obesity. For example, we don't have a lot of research about the nature of food and eating addiction, but we do have a substantial body of research about addiction in general. A lot of these tools, they can be adapted to us. We don't have to wait until they do specific research about treatment of food addiction. We can pretty much start adapting the tools of addiction right now. Another example is stress management. Although not directly related to obesity, it will certainly have a huge impact on your eating habits. And same goes for learning about your emotional health and many other fields as well. Another good source of learning is support groups, but be a bit cautious of those, especially if a piece of advice cannot be cited with a reference or a source where it actually came from. Despite this warning, however, I have to say I was frequently pleasantly surprised at how much information people with obesity actually know. Our discussions were mostly tidying up the information into a usable, trackable system and filling knowledge gaps. The most common knowledge gaps I encountered was mental health and how to use all this information on a personal level. And finally, the most important source of education is you, my friend, your journey so far. Most of my patients try to lose weight multiple times in their lives. It's important to go over them after you arm yourself with knowledge. It's important to make a list of what factors led you to derail off your journey in the past. If these factors are not currently clear, then they will likely be revealed once you start learning more about your mental health. The more you learn, the more you will uncover, the more you will be able to do something about it. Now, it's important to note that a lot of the recent pharmaceutical and surgical advances in obesity management do not do anything to target the root cause. So do not rely on these solely for weight loss. So these include things like pills that affect appetite, medications that affect absorption of carbohydrates or fats, medications that affect metabolism of carbohydrates or fats, and pills that make us urinate more sugar, surgeries that involve manipulating the gastrointestinal tract. I mean, guys, we are cutting the stomach to deal with a behavioral problem. Of course, some of these work really well in inducing weight loss, but make no mistake, all these are symptomatic treatments at their core, since they do not deal with the issue that led to the weight problem in the first place. Besides, guys, the journey is too good to miss. Now, I do realize that this slide is going to generate a bit of controversy, especially amongst my colleague physicians. However, I do stick by my point that cutting somebody's stomach does not really deal with the root cause of the actual behavior that led to overeating and to being essentially overweight. We are cutting a healthy, perfectly stomach. There is nothing wrong with someone who has obesity in terms of their carbohydrate or fat basically absorption, or their fat metabolism, or their kidneys. None of these actually have problems in them. They are just secondary problems to the main issue, the behavioral issue. The best part about taking care of your mental health, about giving your mental health some of your time and some of your attention, is that you will reap the benefits way before any weight loss happens. They start the moment you decide to learn how to live a healthy life. So do not miss out on these. And these are some of the benefits that you can expect. You can learn to avoid using food as an emotional crutch. You can cultivate higher levels of motivation to achieve your life goals. You can have more self-awareness into what's important for you. You can have more resilience while maintaining lowered chronic stress levels. You can have a healthier and more rewarding ways to deal with stress. And you can use your willpower reserve to achieve your goals rather than fight your cravings. You can reclaim a healthy relationship with food where you enjoy your food when it's time to eat. Learn how to cultivate pleasure and joy from everything that you essentially do. And you can imagine once people get these benefits from their weight loss program, then the whole weight loss journey becomes a lot more enjoyable, a lot more sustainable, and it stops being hard and stops being punishing, which I think is the key to sustained weight loss. The journey has to be rewarding, has to be enjoyable. Now, I have spent the last 7 years creating an online course where I gathered all the research and knowledge and translated it into a language that the average individual can understand and adapt it to their life. And it started from people like you, your stories, your struggles, your courage, your perseverance. But guys, don't assume that everyone who looks at you in the gym is judging you. Some might get inspired by your resolve, your determination, and your courage. Like yours truly here. It was definitely a source of inspiration for me. I will leave a link somewhere here for the course if you want to learn more about it. And guys, there's no quick fixes here. It's an educational program that covers the three main arms of conservative management for obesity. And notice that I said three. And yes, you guessed right, mental health is the first one indeed. For the time being, let's go back to what we were talking about. In the next few videos, I will be teaching you how I built this educational program, the principles it stands on, the core values, before we dig into the specifics of it. If you choose to build your own program, I strongly suggest you follow the same principles too. And the first one we already covered in this video, which is the root cause of obesity is behavioral. In other words, mental health. I am hoping my videos on YouTube will propagate this idea, and I start seeing people adding mental health to their weight loss journey videos. And eventually, more funding will go into research in this field. So without further ado, let me tell you about my project. The Obesity Project is basically conservative management 2.0. So the plan is to target the root cause while managing the secondary outcomes. I realize that we don't all have all the factors mentioned in the root cause tree, and some might have others that have not been fully captured. I think the best thing to do is to teach you about all of them. Once you have that knowledge, you can reference to your journey and figure out which ones apply to you. I have to say though, in my 20 years of being a doctor and dealing with people battling obesity, most of these factors apply to most people to some degree. So you'll do yourself good in taking the time to arm yourself with knowledge about them. As you start breaking the cycles running in the root causes, you'll find it much easier for healthy eating habits to fall into place naturally. So as you start learning better coping skills, stress management skills, as you start learning how to experience your emotions in a more rewarding way, exciting and safe, while learning how to ground yourself if things get too much, as you learn more about the effects of certain foods on our reward systems and how it can mess up our addiction circuitry. As you learn all this cycle will start to be deconstructed, breaking you free. And you can do all of this while continuing whatever you are doing with your nutrition and exercise, while you target your weight and subsequently your insulin sensitivity, if your exercise program is constructed correctly, along with other secondary factors as well. I chose to break down my course into 3 phases to be done in this order: mental health, then nutrition, then physical activity. I found that people need to learn, practice, and adapt their mental health tools for 3 months at least to establish a solid base and integrate mental health tools fully, so that no matter how stressful their nutritional plan gets or whatever mental health side effects they get from being in a large caloric deficit, they will be able to handle it. Handle it in a rewarding and nurturing manner that helps their mental health rather than strains it. Now, a good thing about the human mind is that you cannot unlearn something that you learned. And just knowing sometimes will inevitably lead to behavioral changes. This knowledge is further solidified if it has an emotional impact and will lead to further behavioral changes. So allow yourself to feel whatever your mind desires during this knowledge journey. So the main message, guys, is don't give up on natural methods yet. I know that some of you have lost weight and regained it many times and are getting tired. I know that some of you are feeling angry at their bodies. I know that some of you are just looking for the fastest way out, and I don't blame you. In fact, as a doctor, the first thing I will tell you is that I apologize on behalf of all doctors. Now, with all my training across some of the best healthcare systems in the world, we had very little teaching, let alone examinship, in obesity management. But that's a topic for another video. But my message is, please do not judge yourself for not managing to lose weight. Even the medical profession seems to have given up on treating the root causes and are jumping straight to symptomatic management. So stand tall and be proud that you are someone that didn't give up, obviously, since you are watching videos about this. Even if you choose to resort to medications or surgery, I promise you, the journey is too rewarding to miss. And it all starts with your mental health. Questions like, how does food affect the brain, our motivation, and how it affects our emotional experiences in life? How our mental status affects the food choices we make? How food can slowly become our main emotional soothing tool and send us into addiction, along with those consequences. The best definition of addiction that I heard is that it's a progressive narrowing of the things that bring us pleasure. If you are dealing with that now, imagine what life will be like once you break free of it. Other touch points include dealing with cravings in a healthy, rewarding way, binge eating, emotional eating, extracting pleasure from our lives, enjoying our food, and yes, this is indeed a very important thing. Enriching our minds, learning to experience our emotions, being more in touch with our emotions to guide us to what is important to us and enrich our experiences in life. Emotional management, exploring ourselves and our abilities, learning healthy coping skills. Stress management, benefits of stress and the risks of chronic stress. And yes, stress in itself isn't bad, and it does have benefits. Our reward system and how it shapes how much pleasure we feel in life in general. And many, many other points. If you enjoyed this video, please like and subscribe. I will be making more educational videos about various health-related topics, starting with advanced conservative management of obesity. Please let me know how you feel about everything I said, and let me know if you are indeed integrate mental health into your weight loss journey and what was your experience with this. See you soon, champs.